Well, for further expert interrogation on this matter, we're now being joined by two renowned infectious disease specialists, Professor Sunday Omilabu, a human and zoonotic virologist at the University of Lagos, and Dr. John Wangwu, a consultant at the World Health Organization and professor at both Yale and Southern Connecticut State University in the United States. Good afternoon, sirs. Good afternoon, gentlemen. Thank you for joining the show. I want to ask one of you, let's start off with Dr. John Wangwu. Is this a knee-jerk reaction by the rest of the countries to impose this travel ban, especially seeing as South Africa or Botswana did detect this new variant and they do have the ability to combat this virus? Do you think that the travel bans are a little too severe? What's your opinion?
Thank you. Thank you, Howard. Yes, indeed. I think this is a case of once bitten, twice shy. In other words, it's expected as humans that they reacted too quick in terms of having been bitten earlier with this virus, and now with a different variant, they're reacting too quick or too fast. So I can see how, humanly speaking, that reaction is, but it's certainly not necessarily encouraged. In other words, I can say that we needed to wait for a lot of information before any reaction, because there's a lot we don't know.
All right, there's a lot we do not know, and let me turn to Professor Omilabu. Please talk to us. Right now, it's still we're still gathering knowledge about this particular variant, and as it stands right now, what do you think should be the actual reaction of countries right now that we've had another variant of this coronavirus?
Thank you very much. I think what we should be doing is what South African scientists are doing, trying to understand better this present variant. Because as it is now, we don't have much information. Little is known about the virus with respect to transmissibility, with respect to diagnostics, with respect to the impact of the ongoing vaccines. So we need to do a lot in terms of science to actually put the virus where it belongs. All that we know now is there is a variant, which of course is what is expected of any RNA virus. And of course, the only little they know now is it has more mutations than all the existing SARS-CoV-2 strains. Those are the only information we know. So we need to know more characteristics of this virus. And we are getting to now know that it transmits faster than any of the existing SARS-CoV-2. And then, of course, we equally learned that it is only in transmissibility when it comes to the clinical symptoms. It comes with mild clinical signs and symptoms. So, which comes to the table of the scientists that we still need to study this particular variant before we start taking measures. And of course, you can see that the measures is very aggressive by disrupting a travel plan, majorly of Africans. So we need to, all of us need to now be working in the laboratory, demystifying this variant to know what it can do and it cannot do. So we still need a lot of information to get from this variant before we can come to a good conclusion as to how we battle it. Over.
All right, let's actually take this reaction from earlier. Dr. Ayoade Alakija is the co-chair of the Africa Vaccine Delivery Alliance, and she was speaking to the BBC.
It was absolutely inevitable. And may I say, firstly, that had the first SARS-CoV virus, the one that was first identified in China last year, originated in Africa, it is now clear that the world would have locked us away and thrown away the key. There would have been no urgency to develop vaccines because it would have been expendable. Africa would have become known as the continent of COVID. What is going on right now is inevitable. It's as a result of the world's failure to vaccinate in an equitable, urgent, and speedy manner. It is as a result of hoarding by high-income countries of the world. And quite frankly, it is unacceptable. These travel bans are based in politics and not in science. It is wrong. Why are we locking away Africa when this virus is already on 3 continents? Nobody's locking away Belgium. Nobody's locking away Israel. Why are we locking away Africa? It is wrong. And it is also time that our African leaders stand up and they find their voice. African leadership need to sit up in this moment. Our presidents need to wake up in this moment and realize that this is not business as usual. Their continent is at stake. Our lives are at stake. And we cannot allow the world to do this to us.
All right, let's bring in Professor John Omilabo. Professor John, you just heard Ms. Alaki just speak there and her perspective towards vaccine equity and also Africa in terms of this particular virus. Talk to us. Do you support her line of argument that if it originated from Africa, someone would have locked up the key and thrown it into the deep ocean?
Hello. Am I to respond?
Okay, Dr. Wagu, please go ahead, please.
Omilabu is my name.
Okay.
Yes, I told Dr. Alakija's line. And of course, this virus, because they detected it in South Africa, doesn't mean it emanated from South Africa. Who knows where the virus has been circulating without being noticed? So that's the argument. And the virus moved to a number of continents. There weren't reactions from all those continents. Why Africa? And then, of course, if you are looking at the situation with vaccination, we all said that Africans are not being treated well with vaccine coverage. And we all know if you don't have good vaccination coverage, it gives rooms for variants of this nation because those that are vaccinated will always be in danger. The variants come from the unvaccinated, and those that are vaccinated will make their own vaccination useless. So those are the issues. We don't have vaccines to cover Africa. Only 5% or 6% is covered till date. So we expect more variants here because most Africans are not covered. So the virus have the all that it could to move around all those unvaccinated, changing patterns, bringing variants of different natures. And that's what we've seen with this Omicron now, with over 30 mutations. So that's a large, I bet we're still expecting more of it to happen because many more are still unvaccinated. Over.
Okay, let's hear your reactions, Dr. John Wangu. Seeing as you're a consultant at the World Health Organization, do you agree with Dr. Alakija's stance?
I do agree with some of her points, but I always see what is happening globally. First of all, yes, I agree that we don't know where actually the Omicron actually originated, but the evidence simply presents that the cases came out of South Africa. And I think the reaction, as I said earlier, it's a human reaction and it's understandable. When originally we had the SARS-CoV-2 from Wuhan, China, the reaction was fairly similar. A lot of countries cut off traveling to China. But I do agree that it's, as I said earlier, once bitten, twice shy. It's a human reaction that needed some discipline over it instead of the actions that we're taking. But looking at it from a human point of view, I can see why the reaction. I do agree that we needed to hold back and wait until we know all we needed to know before any action.
All right, Professor Omilabu, permit me to come back to you on this particular topic. And my question is, if African countries, if the African bloc were more proactive, because some are saying that these countries are just being proactive, if we are more proactive with the way we've seen that the virus is not as prevalent as projected, probably we won't even find ourselves in this particular situation.
Yeah, you are right a bit in the sense that what is actually projected of the situation in Africa is not what they are seeing right away. The impression is that Africa will have been overwhelmed by now with SARS-CoV-2. And of course, we know we have a lot of health issues in Africa. Our health systems are not nothing to write home about. They are very weak. We have healthcare systems in Africa that are very weak. And then, of course, we weren't prepared for this type of SARS-CoV-2. And of course, most of the African countries, they don't have the wherewithal in terms of vaccine development, in terms of management. So we know we have all these issues in Africa. And that's what we are saying, that Africa as a continent should come of age. It's high time we develop our own healthcare system to such an extent that when outbreaks of this nature come, Africans can rise. Without relying on support, so much support from outside. And that's one of the lessons we are learning, that we need to develop homegrown solutions to a lot of cases, including our healthcare system. So that's what we are just seeing. And Africa need to get together. You see, now we needed vaccines. Vaccines are not available. And that's one of the implications, because we don't have enough vaccines to give to our people. Just 6% Africans are vaccinated till date. So we know the implications. And one of the implications is development of variants, as we are seeing. Over.
So
I'd like to add to what Professor Sunday said.
Please go ahead.
By saying that indeed, because our health system infrastructure is not as good and as effective, that indeed we really don't know how much of the impact the pandemic has had on the continent. Because if the system is not effective in accounting for all those who had it and all those who died from it, then it becomes difficult to really be able to understand the level of mortality and the level of morbidity from the actual SARS-CoV-2.
All right, Dr. Omilabu, let me go and ask you this question. In terms of being proactive, where should the African leaders be focusing their attention at this present moment, instead of discussing the biases of the shutdown and the travel bans with certain countries? Where should their focus really be in order to make time of this for the fact that the numbers aren't as high on the African continent, and we have been given just a little bit of respite. Where should they be focusing their energy?
Thank you very much for that question. I think now we realize that it is high time Africans now come together. We can see just vaccine development. We could not develop enough vaccines for our people. And that's what is really lacking with a response to SARS-CoV-2. We don't have vaccines to give to our people. And whatever we must do, we need to focus on vaccine development. And what is big in producing vaccines, if we really come together, it needs enough funding. So we need to gather as a continent to put all our resources. We can develop vaccines in the continent, and we can manufacture enough that we go around us. So we need vaccine development right away. So we need to produce vaccines locally so that our people can get vaccinated and be covered. Because the more we get covered, the less there will be chance for the coronavirus to mutate. But as long as we have more unvaccinated among few vaccinated, the resultant effect is development of variants. So to me, I would want us to focus our attention on vaccine production locally. Over.
All right, Dr. Wagu, I'll still throw the question to you. Should African leaders be focusing on trying to produce and develop their own vaccine or strengthen the very fragile health infrastructure here? Which do you think we should do? Because some are claiming that we cannot walk and chew gum at the same time.
Yes, Aaron, thank you for the question. As much as I agree with Professor Sunday regarding African countries working together to effectively improve the healthcare system of Africa, I would also recommend other more cheaper efforts that could be made, such as health promotion. Example of health promotion will be wearing of the mask, and it's easier for us to produce, much easier and cheaper for us in Africa to produce masks. And there are also alternative ways of covering our nose and mouth. So if we begin with what is more reasonable in terms of cost, I think that will also provide us some level of protection. Because when it comes to disease control, there are basically two areas of strategies. One is health promotion. Two is disease prevention, which is where vaccine comes in. And then three is actual treatment of the disease. And so if we have the challenges of disease prevention, which is production of vaccine, and we have challenges for the actual treatment of the disease, then we should be wise to focus on the first one, which is health promotion. And that will be doable and much more effective for us.
All right. I want to say many thanks to the both of you for your insights this afternoon on Newsday, Dr. Wangu and Professor Omilabu. Thank you very much.